Hello, everyone. Sarah Barker with the Connect Our Elders Empowering Aging podcast. And today I have with me Annie Soliman, the owner of Care Crew. Thank you for being my guest today, Annie.
Oh, my pleasure. Thank you for having me.
You're very welcome. So what we want to dive into today, I'd like you to share with the audience a bit about your background and then how did Care Crew get started?
Sure. So my background primarily is in the healthcare industry. I've been a nurse for longer than I care to admit, but probably close to 18 years now. I've been a nurse practitioner for about 12 of those years. I've worked in a variety of settings, whether it's acute care, hospitals, home care settings. I've worked for managed care companies. I've worked for specialty offices. So I've had kind of a wide variety of healthcare experience. But what brought me into the home care setting again, I was doing transitional care house call visits. So when folks would be hospitalized and discharged home from the hospital or from an acute rehab or any type of facility like that, we would come into their home and we would follow with them in hopes of preventing a relapse or a rehospitalization. So our goal would be to stabilize them, help to make sure that they get where they need to be to stay home. And that's kind of what brought me into being this awareness of home care and caregiving services, and that was a thing. Because I'll be honest, as a provider, we don't get educated on those things. We don't understand what options are out there for people. Like, we know we write orders for home health or things like that, but you don't understand what the resources are. So I would have families that would, come to me and ask me as I'm getting ready to finish up our time together. They would sit there and ask me, well, mom's not really 100% yet. Home health is their cert period's over tomorrow. I'm working. I don't know what to do. Mom's here by herself. And, I don't like to have a blank stare on my face and say, I don't know what to tell you. So I started, what do we all do? We go to Google and we say, what do we have out there? So I started Googling, home care and caregiving and resources. And I didn't find a whole lot of great information, to be honest. And then the stories I did hear from patients or families were those, the horror story things that you hear that nobody wants to hear, but it's kind of like anything. They remember the bad things. They don't always remember the good things. Mm-hmm. So it's, oh yeah, my dad had a caregiver a while back and, she took his car for a week, or, they did this, they did that. They were sleeping on the couch, whatever. And so I always say it was a God thing. We are a Christian organization, and I just, I went to my husband one day and I said, there's got to be something better for these folks than what they have. There's something here. I don't know what it is, but there's something, there's a reason I keep being pulled to this. And so thankfully I have a very supportive husband, and we had a series of events that I say you cannot explain away. It was not just coincidental, but it basically allowed us to create Care Crew. So that's kind of where Care Crew came from. Mm-hmm. I decided I wanted to do something different, that I wanted to be able to bring comprehensive home care to the patients I was already serving. So that's kind of where we came from. We looked at different routes of how to make that happen, but at the end of the day, my husband and I decided to just have our own independent agency and went through that whole process. And here we are, almost 2 years later.
So would you say, so you've told us how Care Crew got started. Is that the foundation behind Care Crew, or do you want to add more to what the foundation is?
Yeah, that's pretty much it. I do have kind of, I joke and call her my partner in crime, but one of my old coworkers from a couple of practices that we work together in, her name is Brittany Hamilton, and she really was just a friend of mine, and we worked together, and her mom had dementia, our grandmother, I'm sorry, and she had been her primary caregiver for a long time. So her and I would talk about those things. And then again, we kind of crossed paths again as Care Crew was being created. And she decided to kind of hop on and said, look, if we're going to do this, we're going to do this different. And we're going to be trailblazers. I want to come out here and give people what I wish I had when I was caring for my grandmother. And she jumped on with me, and the rest is history. She's been there basically from day one, from the time I got my license and opened the agency. And now she's my director of business development. and she's out there. She's a dementia practitioner and a PAC trainer and all those wonderful things. And so that's kind of the foundation of Care Crew. We really just decided that if we're going to do what everyone else does, then that's the day we're going to close our doors. And in whatever services that we provide or whatever programs that we have, we want to make sure that we're doing it with our spin on things and bringing something new to the table.
So we'll get deeper into that, but I'm curious. So you guys have these backgrounds, you've come together, Care Crew's growing. What are your feelings on the importance of collaboration, or have you guys, I have found, right, especially throughout the pandemic and even now, the agencies who are willing to be collaborative in nature really weathered that whole storm much better, right, than those who weren't willing to. And even today, because of the caregiver shortage, those that are willing to collaborate are stronger.
Oh, yeah, for sure. I mean, we wouldn't be where we are, in all transparency, without our community relationships that we have. So our primary source of referrals are our community partners. We have, instead of, we joke and say we don't have marketers, we have business development folks, because our role really is to create relationships. So we work very, very heavily with, whether it's communities in our area, home health agencies, hospice agencies, senior living placement specialists. And without those partnerships, we would not really be able to provide as high of a level of service as we do. I mean, yes, we can do amazing things on our own, but like you said, it's not as good as it could be if you have the buy-in from your community. So what we really try to do is provide education and value to them to show, hey, this is how, as a caregiving agency, we can help your outcomes become better, and we can work together to keep those patients optimal. So we really focus a lot on education. We provide PAC training to some of our community partners as just part of growing a relationship with them. And yeah, really, because interdisciplinary teams and interdisciplinary care is the direction that all of healthcare really kind of goes to. And I feel like we have the research to support that. And we have the anecdotal evidence. I have stories upon stories about, how we've been able to work together with a hospice agency to get someone home successfully, make sure they have what they need, that we can get them end of life care, or home health agencies, giving them the information pieces that they need to best take care of that client, make sure that they get, orders written, or they get a plan of care altered to meet those needs. So yeah, collaboration. I think if you feel like you're an island, you're going to sink real quick. You just can't give the best care and the best value to your people if you don't utilize, like you said, resources.
Because we all have our space on the continuum, right? Like it all works together, all wraps around the family. So have you guys found any benefit in collaborating with other home care agencies? So we're talking about collaboration with community partners, but have you noticed, since you launched your agency, selecting certain partners, while they might be competitors, you're like, okay, we're all in this together?
Oh, yeah, for sure. We are a little picky about who we work with, to be honest, because I expect that the people I partner with or that I will collaborate with will treat my patients and clients the way that I want them to be treated, or that I would treat them. So I put a lot of legwork into vetting these folks out ahead of time and really developing that relationship and trust with them before I take that leap of faith and collaborate with clients. But honestly, we see a great benefit because we are a very niche agency. So we are not one of the, catch-all agencies that, any kind of care mom and dad need, we got you. We really focus on the most medically complex, the most high level of need clients.
Like high acuity cases.
Yes, the highest acuity people. We joke and say, send us your train wrecks, I got you. We do RN delegation. We have a pretty complex dementia program. So we can handle those things. And so, to be honest, I don't have the manpower or desire to take on a companion care case. If mom just needs someone to bring her to the grocery store a few times a week or to the doctor's office and just need a companion just because, she's alone, I will refer those cases out. And in that case, I need a good community partner in my area that I can send them to, and vice versa. We have other agencies that are like, look, we want to be the companion agency. We don't want to take those complex cases. We don't have nurses on staff. We don't have that level of care or oversight. So I would rather send those to you and make sure that I know you can take care of that. So community partnerships within home care agencies has been very beneficial for us as far as making sure the folks that get referred to us, if they aren't the right fit for us, still get care. Because we want to be solutions people, right? We don't want to just say, sorry, we're not for you, or we can't meet that need, and then best of luck to you. So we want to make sure we can connect them with someone that might better meet their needs or suit, where they're at in their journey right now. And I hope that other home care agencies see the value in that too, because I think some people still get in that mindset of like competition. And we joke that we're only in competition with ourselves to always do better and, always try to find ways that we can improve our own care. Like I have blinders on, to be honest. I don't see what anyone else does because we got enough of a road to travel on our own. Not have to worry about what everyone else around us is doing. So hopefully the other home care agencies start to do the same, in other areas, because I think it's a huge loss if you aren't utilizing.
Yeah, and that's why I asked, because that's what I was saying is that I've noticed, especially in the last few years, those home care agencies who are willing, I call it fidelity to the cause, not the job, right? Of course, every home care agency wants their company to grow naturally, right? But if we all have this faithfulness to the larger cause that we're all in together, then I've found those agencies that have that mindset, they've really gone on to do better than the ones that are operating from that greediness.
Oh yeah, well, it's like a scarcity mindset. You have to understand that there's plenty of people out there that need care that none of us could even ever service all of the people out there that need our care, and that not all business is good business. It's not in anyone's best interest to take on patients or clients that are not maybe your ideal person or whatever, just because you think you need the hours, when maybe they would be better served in a different, with a different type of agency. So I always tell my team all the time, I'm like, hey, not all business is good business. Love and release, whether it's good or bad or otherwise, because, you have to focus on the people that are your people.
Did you guys know that this was going to be your niche in the beginning, or was it an evolution? Right?
Okay, we're starting an evolution for sure. Because when you're new and you're starting and from nothing and from scratch, and to be honest, yes, I've been in healthcare. I know nothing about business and home care and all of that. Like it was a big learning curve. And same with Brittany, she was used to running a surgical practice, and none of us had really extensive home care experience. So you're kind of floundering around and throwing things up against the wall and what's going to stick, what's not going to stick. So we've tried kind of everything. And then it really was just a natural progression of what kinds of clients do we seem to do well in and that we can best serve, and what clients do we seem to struggle with. And that was what we were seeing. We have a very abnormally high touch type of an agency. So we invested upfront in personnel. So we are very personnel heavy compared to most agencies. Like I have an RN on staff. I had, at the time, I have 3 care coordinators. For the amount of clients we have, it's very skewed, but that's because for a purpose. So I would rather have done that, because we provide at least once a week personal touch-in visits with our care coordinators to make sure that things are going according to our plan, and that there's no changes, there's no issues, needs, any care coordination that needs to be done, case management type activity that needs to be done. So it just, it lends itself well to those complex cases. Whereas someone that just wants companion care, they get annoyed, frankly, with us coming. They're like, why are you here? I don't understand why you're here again. Everything's fine. Mom's doing fine. So it's just kind of a progression. And, we saw that those more complex medical cases were where we thrived. And
because you're bringing this element of case management to it. So we may have already answered this question, but I want to ask it just in case. What makes Care Crew different from other agencies? I think we've already touched on it a lot.
Yeah, to me, what I explain to people is, we're owned by healthcare experienced folks. So, I bring my nurse practitioner brain with me. I can't take that off. So when I go and assess patients and meet with families, and I still am very hands-on. As much as I can be hands-off in operations from an owner standpoint, I enjoy that personal touch piece. Like I miss being out seeing patients if I don't do it. So when I go meet with them, I'm still bringing my NP lens when I'm looking at what's going on with them. So obviously that piece makes us different, as well as just the our case management piece. So our standard of care across the board is a monthly care coordination. So I go out and do a visit with all of our clients once a month. Can be up to from 1 to 3 hours of my time to care coordinate for them, whether it's education, whether it's reviewing their medication list, whether it's speaking with their providers about concerns that we're seeing. We also have a 24/7 virtual care agent in the home called Sensi AI, and I don't know if y'all are familiar with it, but because we do a dementia specialty care, and Tifa Snow kind of helps create the Sensi AI information, that was the direction we opted to go in. And so that's part of our care coordination as well, where we review that data and we bring those family reports out there to the families to go over what insights the technology is seeing. Wow. So that really is what I feel like sets us apart, because we really focus on being proactive with these folks because they are so high risk. Eons ago, I used to work for Humana, and my goal doing visits for them was, how do I keep these high utilization Medicare PPO patients out of the hospital? I got judged, and my success was based on how few hospitalizations my patient panel had. So that's kind of the lens that we take. And so I think that's what makes us a little different, is we're not afraid to go in there and identify issues or potential issues and bring that to the attention of whoever needs to be seeing that information. And sometimes they don't want to hear the information I have, and that's okay, but I'm going to give it to them anyway. And I'm going to be the squeaky wheel if I have to. So that's
almost, we have an ethical responsibility.
Exactly. And, like we talked about before, for whatever reason, I feel like a lot of times home care agencies don't have that seat at the table to advocate as strongly as they need to for their folks. Our caregivers are in the home more than anyone else. And so I always tell them, I'm like, you have valuable input into what's going on. I know when I did visits as an NP, I would always ask the caregiver. I would usually go to them before the family, because if they had a caregiver in there, I know that caregiver knows what's going on.
They're the first to identify a issue or a potential issue.
Exactly. I know that if I ask them, when was the last time they had a bowel movement? Hey, how has their urine been? Is it smelling funny? Are they going more often? They always knew those answers for me. So I always tell the same to my caregivers and say, hey, you have a voice and you have valuable information here. So whatever that you're seeing, I want you to communicate that with me, because that's what's going to give your client the best chance of success.
I like that. So we kind of mentioned advocacy a little bit, but let's go deeper into that. So your agency does a lot of advocacy work. Explain to the audience what that entails and what it looks like.
The interesting thing with advocacy is it kind of is different for every client. And it just depends on where they're at in their healthcare journey and, what their circumstances are. But I can give you a great example that I actually just had run into yesterday that I'm still working through. We have this poor lady that's been on my services for quite some time. She has chronic peripheral vascular disease, so her legs will swell up. She'll have, wound issues on her legs. We get it under control, and then, a couple months goes by, same cycle happens. Well, she's going to the primary doctor, who then either sends her to the ER or sends her to a specialist, or they don't even look at it. Then they send her to a lymphedema clinic. Well, it's a taxing effort for her to go 3 days a week to a lymphedema clinic, who has had limited success anyway with getting optimal results. And her home health at the same time can't be in place if lymphedema clinic is seeing her. So we went back to the doctor yesterday, and they said, oh, well, she needs to go back to lymphedema clinic because her legs are swollen. I said, okay, I've been patient, but here we are. This is our third cycle going round and round with trying to get this, these orders under control. So I called her primary care doctor and I said, look, I understand that this referral's been made, but I don't know if you're aware that she's already been there for 2 different cycles. You cannot have home health if you send her there. So what is your plan if she goes to lymphedema clinic and her wounds start to resurface and there's no one in the home to care for those wounds? What's our plan?
Anna, you sound like an independent care manager to me.
Yeah, I mean, essentially, I guess that's what we are. And, we just are not afraid to bring our concerns to these providers. And I think sometimes for just lack of confidence or lack of, feeling like they can speak up, those things don't get addressed. And so, otherwise this poor lady's going to cycle round and round and round. And she expressed to me, I don't want to go back to the lymphedema clinic. I'm frustrated. I don't know what to do. And so I just said, okay, well, I'll take care of it. I'll make a phone call and, we'll make sure that we take care of it. So that's kind of one example of what our advocacy work looks like. Some other things, for other patients, it's making sure they get resources in place that maybe they haven't had or that I can identify that they need. For example, I do a lot of hospice work, mainly because we do delegation. So a lot of times they'll refer patients to me that need comfort meds, but they don't qualify for crisis care yet, or they're in kind of a gray area. And but sometimes I have patients that aren't quite on hospice yet, but I know their qualifying diagnoses. I can see the decline. And most doctors are afraid to have those conversations with their patients for whatever reason.
Whether it's all day long.
Whether they're uncomfortable, whether they're afraid they're going to lose business, whatever. So I'll sit there and have those conversations because they know me. I've done their initial assessment. I see them every month. So it gives me room to bring those things to the surface and say, hey, I know this is what we've been working on, but I want you to get the most resources that you can. I want mom to have as much care in the home as she can. Does mom want to go back and forth to the ER anymore? No. Okay. I have a community partner that I would love to connect you with that will provide you with XYZ, ABC, services right here at home. And we can work together to get mom optimal. How about that? And then that groundwork's already been laid. And then there you go. The family is now open to those conversations. The hospice team comes in, they do their thing. And then, it's
education. Education, right? And I've been saying for many years that the relationship between home care and hospice has a lot of room for improvement. From home care, we should be able to identify when somebody, we can't say for sure that they're going to qualify, but we could at least start the conversation and start the education process, right? So that way, hopefully we can increase the average length of stay on hospice.
It is such a shame. Most of the time with hospice, they don't even get onto services barely by the time that they're transitioning and imminent. And then you look back and you say they could have had support for that wife or that son or daughter and caring for that patient for 6 months prior to this. Right. And that could have made such a difference in how those loved ones spent those last months together, from being stressed out, on edge, trying to get things in place for them, to all of a sudden now having this supportive care team in place to allow them to just enjoy whatever time that they have together. And it's such an underutilized resource because it has that stigma, nobody talks about it. And I'm like, what's the worst thing that happens? They say no, thank you.
You know what I find? It's a matter of the tone and the delivery and knowing who you're talking to, right? Because I kind of feel like if we're not the ones, if they haven't been educated yet or nobody's talked to them about it yet, but we've been in the industry and we're like, well, I think that they might be, I don't know. I'm not writing the order. I don't have to, but I'm going to start the conversation, right? At the end of the day, if it's not what they want, that's fine. Or if they, don't qualify, but at least we've done our part to get them the extra support. And I would encourage any hospice partners that are listening in right now or watch the recording. I've thought for years, there's a lot of room for improvement on the home care hospice relationship, meaning home care can do a better job of identifying earlier, starting the conversation for you guys with these families, but also hospice, don't forget to bring us sooner into the picture, right?
I tell you, that is one thing that I do see is, most of my hospice referrals are end of life. There's been times, I think my record is going to do a delegation and 2 hours later, the person passed away. And you're like, not that I mind going out and doing all of those things, but is that really best for the family to not have had that help until it was almost too late? They really didn't get granted, our staff was there when he passed, but they didn't get the benefit of having that support for any other length of time. So,
I would like to do what we can collaboratively within the industry to minimize the amount of suffering.
Yes.
That happens simply because they don't get resources as quickly as they should.
Yeah, and I think, it goes back to preconceived notions, whether it's hospice or home care. I think home care has the same thing. A lot of our community partners, Brittany and I do a lot of education with them to understand, when to refer to home care. Hey, look, you don't have to have the conversation about money. We're a primarily private pay agency. So a lot of people automatically will look at somebody and judge them as far as, oh, they can't afford care, so I didn't send them to you. Well, do you know that? Because I'm pretty sure you probably didn't have that, no access to their financial documents. And that's a kind of a judgmental, thing to do. You have no idea what that person's resources are. They might be insurance policy heavy and have 2 or 3 LTC policies in place. They might have a relative that has the funds and wants to pay for care. That's not your job to need to know that.
I am so impressed to hear this, because it's part of what I teach at these academies I do, which is try to train your referral sources, whether it's a healthcare type or a legal financial person. They don't need to have that conversation, right? They just need to recognize that this person needs some guidance around senior care resources. We'll have the financial conversation, because I tell this story often. The largest revenue producing client I have, right? Because we're talking about business now, husband and wife, 24/7, 2 caregivers, almost 2 years, and they lived in a trailer in San Diego. Yep. Would you think, by looking at the service, that they would have been able to afford that?
No, absolutely.
It's just they lived frugally. They invested well, and it was important for them to stay home. So we don't want other people predetermining whether or not somebody can afford our services.
Oh, yeah. And some people just don't feel comfortable. It's kind of like a hospice conversation. They don't like to talk about money with people, especially, my home health and hospice partners. They don't have to deal with money conversations because they're all insurance based or Medicare based, and they don't have conversations about finances unless they're looking at like a Medicaid application. And so sometimes they go, ooh, I don't know. I don't want to talk about that. I say, please don't. I'd rather you not have that conversation.
Right, exactly.
Let them know that we will call them and we will have a conversation. We'll come out and meet with them. And even if they're not the right fit for us, or they're not going to be able to come on services, then we will connect them with something or someone that can at least give them some type of benefit. Because there's times that I've had referrals that I've gotten them onto hospice care strictly for that reason, because they needed bath help. That was kind of their primary need, was they needed help bathing mom or dad. And they couldn't private pay for care at our level of service. And so I said, why don't we look, has anyone talked to you about hospice care? And mom had CHF, it was a qualifying diagnosis. Definitely, I knew based on looking at her would meet criteria. And they said, no one's ever actually had that conversation. Is that something mom could get? And I talked to her. I said, yeah, and you know what? My hospice partner, so-and-so, they will come in 3 to 5 days a week. We'll help you to get mom a bath and make sure she's clean. And they're like, wow. And how much does that cost? I said, that's Medicare, 100%. You're not paying for that. And they were so eternally grateful. And I'll tell you what, when end of life came, who did she call back? When they really needed care. They remembered, because I didn't do that because I was making money off her. I was, we were doing that because it was the right thing to do.
Being a resource.
Exactly. And that's why I train my team all the time. I said, it has nothing to do with whether that person is a client or will ever be a client. You do right by the people that you're around and that are referred to you, and that will come back around, whether it's now or a year from now. It doesn't matter.
I have believed that the entire time that I've been in this industry, and in time and time again, it's proven true. And your story right here validates it again. Yeah. So we're getting close. So final question, what is something that Care Crew is doing to give back to the community?
Well, I'm glad that you asked about that, because that's actually become a huge passion and like a ministry of ours, especially with the veteran population. So my business development team are an active duty military family. They're an Air Force family, Brittany and Cody. And we started taking veterans benefits, and we found that was also kind of a niche of ours. The veterans in our area were somewhat underserved. A lot of people didn't want to serve that population for whatever reason. And they are hard to gain their trust at times, for whatever reason, whether they're a veteran that's an active combat vet and they've got PTSD and they might be a little anxious about someone coming in their home. But having, one of their own come in and talk to them, that wall would immediately come down. So long story short, we've really dived into serving the veteran population. So this past fall, we did a homeless vet project. We had 25 different area communities and community partners that had donation boxes in their facilities or in their offices. And we were able to make over 300 care packages for homeless veterans in our area, and went out and distributed them to our VA case managers list of clients that they knew were in different shelters or different areas. And then now that has actually turned into us creating we're calling it a carnival, but a spring carnival, basically serving seniors and veterans in our area. So we are now up to about almost 100 vendors. We have local celebrities, high schools, bands, all sorts of just crazy things that Brittany has gotten in place. We have about 12 main sponsors that are helping us in organizing it. And it's going to be actually at the Texas Motor Speedway here, which is like a huge venue. But we wanted to create something for seniors and veterans to come out for free, not have to pay a dime of their own money, have a fun day, and learn about the different resources that are here in the area for them, whether it's a healthcare resource or just another resource. So that's kind of our current project that we're working on, which we hope will be, hugely successful. And again, it's about education. It's bringing folks to the population in our community so that they can see what things are out there when that time comes for them. Mm-hmm. So we try to really focus on just a lot of those service projects. So those will be our 2 annual service projects going forward. But like we said, you put those good things out in the community, they're going to come back to you. So that's currently kind of our community project of the moment. So
I think that's wonderful. And thank you. I'm a veteran myself. I know many veterans. I love all my clients, but my favorite clients over the years have been my elder veterans. I'll say it.
I think it's another level of reward. When I always tell a story that, private pay, obviously treating anyone or serving anyone it gives you that warm, fuzzy feeling. But when you go from, all private pay to someone that had no resources, no family, no support, was declining, depressed, to now getting full-time care paid for 100%, not a dime out of their pocket. I had a suicidal veteran that admitted to me he was not wanting to wake up in the morning. He wished that God would take him. He was super depressed about having a Parkinson's diagnosis. His friend died of Parkinson's 6 months prior, and we got him 38 hours a week of care. And I went back a week or 2 later to see him and put his Sensi device in, and he just had the light in his eyes had returned. And he just said, I know I have to wake up in the morning because Jaya is coming to make me breakfast and I have to wake up. And, when you see those kinds of outcomes as an owner, you're like, okay, this is why we do what we do. And this is why we need to keep serving this population that we serve. So
I agree. Well, I feel like we could talk all day. One last thing. So with this giving back to the community initiative, an organization that you might want to look into, they call it Operation Stand Down. I don't know if they do that in your area. It's very big in San Diego and in Nashville, but
yeah, Brittany's gotten in touch with, we were working right now with Wounded Warrior Project, with Texas Strong, Operation Texas Strong. There's also another organization locally that this gentleman rehabs RVs, and he gives them to veterans. So that's really where all of our proceeds, if we have any additional proceeds left over after the event, all of them are going to his nonprofit. So that way it gives housing to veterans that might not otherwise be able to have housing. So yeah, but any other resources you have, send them our way, because we would definitely love to reach out to them and get anyone on board that we can.
Well, I really appreciate you being my guest today. Very much enjoyed the conversation.
Thank you so much for having me. I love your podcast, so it was my pleasure.
Thanks. We'll do it again.
Yes.
All right. I hope everybody had a great day and enjoyed this Empowering Aging podcast. And I'll see you guys all next week. Thank you, Annie.
Thank you. Bye.